Welcome to Scrubbed In and Speaking Out, the podcast from the Registered Nurses Union of Newfoundland and Labrador, where we talk about the issues facing nurses and the advocacy shaping the future of public health care in our province. I'm Dan Williams, Digital Communications Coordinator with the RNU, and I'm joined today by our President, Yvette Coffey. Welcome back, Yvette.
Welcome back, Dan. Happy New Year.
Earlier this month, you sent an email to our membership. Instead of a typical New Year's message welcoming in the new year, you spoke very directly about frustration, exhaustion, unsafe working conditions, and you framed RNU's priorities this year as New Year's resolutions. So before we get into each of the resolutions, why was it important for you to be that direct with members right now?
At this point in time, we have a new government in place. We have a new health minister. We have a new premier who's made some extraordinary promises to the people of Newfoundland and Labrador, especially in regard to our publicly funded healthcare system. So it is time for us. We need honesty. We need action. We do not need empty promises. So we're pressing the reset button at the Registered Nurses Union.
Let's start with our first resolution, nurses prioritized. When you talk about prioritizing nurses, what does that mean in real terms for our members?
To prioritize nursing for me is to clarify roles, to clarify scopes of practice, to recognize and respect that nursing, whether you're a registered nurse, a nurse practitioner working in the system, that your critical thinking skills and your expertise needs to be recognized. And I don't just mean recognized as in you have a manager who does not understand your role, which we hear very, very common in our healthcare system, because most managers these days are not nurses. And if you are not a registered nurse or nurse practitioner, you cannot eloquently speak to the role of registered nurses or nurse practitioners. And what we're talking about is not only recognizing the role and the expertise and what registered nurses, nurse practitioners bring to the healthcare system, but also compensating them, fairly and equitably for what they do bring to the system. One of the things we talk about is registered nurses and nurse practitioners having to do what we call non-nursing duties. Registered nurses should not have to be doing the work of other healthcare personnel. That is taken away from direct patient care. It takes time. If you do not have environmental services or carbolizing and it's 3 a.m. and you have an admission and you need to move patients, well, guess who's going to clean those beds? And guess who's going to move around those patients? It is the registered nurses. And that is taking away from caring and doing actual nursing work. If you don't have clerical, if you don't have laboratory or x-ray personnel or physio or occupational therapy or social work, it all falls back to nursing, because registered nurses are there 24/7, 365 days a year. So it's about recognizing nurses need to be nursing, not doing other people's work. And also about allowing nurses to work to their full scope of practice. So nurse practitioners, one of the biggest things we hear from nurse practitioners is about their decision-making around their clinics and organizing their clinics or planning their clinics or their workload, and being questioned and managed by people who have no idea what it is that they do. I get that. Any registered nurse or nurse practitioner you talk to gets that. You talk to the leadership of the health authority or you talk to government officials, they get that. But yet that's what our members face on a daily basis. So it's getting at all of these things, getting back to nursing the way it should be, and getting back to the respect for the profession and the respect for the work that we do, and allowing us to work to our full scope of practice.
That brings us to nurses retained. You and I had a podcast fully devoted to retention. So we're well versed in some of the issues, but to reiterate it for our membership, of course, in the public and in the media, we often hear about recruiting nurses, and that's important. But we need to consider why nurses are leaving our profession at the rate they are. So let's jump in what you're hearing directly from members across the province. You've been touring on the President's Tour. You've been having face-to-face meetings with members, which I think they appreciate. What are you hearing directly from them about why people are leaving?
It's the same thing everywhere we go. It's the workload, the mandatory overtime, working short. It's skill mix issues. Our members are burnt out. They are suffering what I would call vicarious trauma, burnout, fatigue. It's an ethical dilemma, a moral dilemma for registered nurses and nurse practitioners who are working in the system today. And if we're going to retain people, we have to have healthier workplaces. We have to provide safer workplaces. We have to provide a caring, adaptive, supportive environment for nurses to work in. So that means going to work and knowing that your shift is over when it's supposed to be over. And you're not going to be mandated to stay tonight or go home for 4 hours, come back and do another 12. You're not going to be mandated 2 days in advance on your weekend off, which you had plans for. And you're not going to be mandated, in advance to come in and work anyway, regardless of your plans, your home life, your family. The other thing is the lack of support. I've already talked about, the lack of nursing management and nursing leadership within the organizations. But we also have a lack of support from the employer and from government as a whole. We bring solutions, we bring ideas around retention. I've been part of the Federal Retention Toolkit, which is now the work plan that we're using for our provincial nursing network that we negotiated in the last collective agreement. And it is quite clear even at that level that we're not doing enough to retain nurses. Nurses who leave the system or leave a position, they're not doing that on a whim. These are very big decisions that are being made. And in order to sustain their own health or to improve their own health, they need to leave. So all the solutions, all the ideas that we've been coming up with that members on the front line have been giving us, and we've been taking them and going to government and going to the employer, have to be instituted. On our recent tour, I had an ICU nurse, they told me about, they got 2 ventilated patients in ICU. They're also covering charge. They're also covering responding to codes within the hospital. And the manager, they fill out their forms. Nurses fill out their professional practice forms. And the manager says, in response to the form, everything done that could possibly be done. And that manager then walks out of the building. In this situation, it happened to be a nursing manager. And my response to that is everything was not done because that nursing manager could put on a set of greens and went in and did some basic nursing care to help care for those patients. So it's that kind of lack of support, even within the system, that is driving people out of the system just to sustain themselves.
Which brings us to the next resolution. Nurses protect it.
If you do not feel safe at work, and that is a fundamental right of every single worker to have a safe working environment. But yet it's fine. And I always use the example. If you walk into Walmart and you assault the cash register employee, no matter if you're under the influence of drugs, alcohol, or you're having a psychiatric episode, mental health crisis, you're taking out of there in handcuffs. If the same situation happens in a healthcare facility, more often than not, there's nothing. There are no charges. We're seeing more and more that, and we are encouraging our members to call the police. We have every right to lay charges against someone. But the onus is back on the employer, who has to provide a safe work environment. I have been calling, along with my colleagues, fellow union leaders with the Federation of Labour here in Newfoundland and Labrador, for an independent health sector safety council. So we do know the highest rates of violence are being experienced in the long-term care sector. And also out in personal care homes, long-term care facilities. Yes, you hear about the emergency rooms. I've heard tell even over Christmas of patients actually fighting with each other, because of the long wait times, and questioning each other about, why are you even here? So there's frustration, yes, on the part of patients, families, loved ones. But the onus and responsibility is still to keep our employees safe, to keep all our members safe. So we didn't get an independent health sector safety council. So therefore, what we did get was a tripartite committee. And I volunteered to be co-chair of this with the other unions, Workplace NL and Newfoundland and Labrador Health Services. We've only met a few times thus far. We do have a terms of reference and that done. But it does not include the private sector for long-term care and personal care homes, nor does it include home care workers. It's like our community health and our public health nurses. If you're going into someone's home, the only thing we have right now, the tool that we have, is a questionnaire that we ask patients and families. Do you have firearms? Well, are they stored properly? Do you have any drugs or drug paraphernalia? Is there any illegal drugs or whatever in the house? Like, who's going to say yes? Dogs even too, animals. And we have to tell them, okay, put the animals away. But it's not until our community health nurses actually get into someone's house that they actually know what it is they're getting into. And sometimes they're already inside the door before they realize this is not a safe situation. We have to do better. The employer has to do better. And, some of the incidents I've been involved in the past few months they're very scary, but they're very frustrating because our members are doing the documentation. They're filling out their peers reports. They're filling out, all the paperwork that needs to be filed. But they're still getting injured because oftentimes their issues and concerns are falling on deaf ears. And instead of doing what is expected under legislation and occupational health and safety, they're basically trying to shame nurses, the poor patient. Yes, we care for patients, but we can't care for patients if we're not safe ourselves. I will continue to fight for an independent health sector safety council along with my other union leaders. But in the meantime, I promise that I will continue to bring forth the issues and concerns of our members. And I would encourage all our members to please continue to document your issues and concerns. If you have a question or concern, reach out to our labor relations staff who are very knowledgeable in the right to refuse unsafe work. It is no longer, Yvette, you're being mandated to stay 24 hours. And if you don't, we're going to report you to the college. No, I have a right to refuse unsafe work. There was a nurse who said to me recently, we've talked to the college and said, at what point what hour is it that a registered nurse or a nurse practitioner says, I'm not fit to practice?
Is it 16? Is it 18? Is it 24?
Is it 30? And the response from the college is every single registered nurse practitioner, nursing provider, it's their responsibility to recognize in themselves when they're not fit to practice, when they're too exhausted or fatigued. And this brilliant nurse looks at me when I'm saying this and says, So is that what the RCMP or the RNC would say to someone who's under the influence? Do you feel you're too inebriated to drive this vehicle? And it set me thinking. I was like, okay, so the expectation right now from the colleges, from the employer, is that the onus is on the registered nurse to say, I'm not fit to practice. When in actual fact, what should be happening, there should be a tool for an assessment, and it should be the employer recognizing that after 12 hours, it is not sustainable for somebody to be caring for the sickest of the sickest in our province. Because there's nobody in a hospital in an acute care setting or a long-term care setting or a community health setting that is well. They're coming to us for healthcare needs. And for me, it's not just about recognizing, okay, Yvette, you're too tired. You got to tell your manager you can't work. The responsibility lies with the employer to ensure there's someone there to replace me so that we don't get to a point where I'm being mandated and having to make a decision about whether or not I'm fit to stay, or if it's better to have me here not fit versus no one. It should never be the registered nurse or the nurse practitioner having to determine that. That's the employers. So safety is a number one priority, and we will continue our fight for safer workplaces for every single registered nurse and nurse practitioner. And that includes not just safe hours of work or nurse-patient ratios. That also includes having the proper equipment on hand. It also includes continuing the advocacy for compensable workplace injuries, such as psychological injuries, so that I do not have to prove to Workplace NL or to the employer my psychological injury as a result of my workplace. And making sure that when someone is injured at work, that they are compensated appropriately. Right now, a registered nurse or a nurse practitioner who files with Workplace NL, by the time they get a paycheck, it is 50% of what they actually make right now in their role. And that is why we know there's a underreporting of injuries, because people cannot afford. They cannot afford to be off work and in receipt of Workplace NL benefits. So therefore, they're using, sick leave. So we have higher rates of sick leave in the system. And we also know that then compounds the issue because it's a cycle. I'm injured. I'm using my sick leave. Now you have to replace me in the workplace. If we had safer workplaces in the first place, we could stop that cycle. And we would improve not only the health of the people working in the healthcare system, but also our patients that we care for.
Yvette, in the email that was sent out with resolutions, you also committed to nurses sustain. That was resolution number 4. So what does sustainability for a long nursing career look like?
Sustainability for nursing is having a schedule that you can count on, is, getting time off when you need it, getting rest periods during your work hours, getting your breaks. A lot of nurses eat at the side of the desk while they're trying to document, instead of actually stepping away to reset, refocus, and, eat. Have their own lunches or their coffee breaks or whatever, and time away from caring for people. It's also about, getting your time off, getting time off for that wedding, for your friend's wedding, for your son, your daughter's, their high school graduation, their graduation from post-secondary. It's about, doing overtime if you want to do overtime. If you feel that you can do overtime, it's optional. It's not mandatory. And it's about being healthier. And what I mean by being healthier is healthier in that your hours of work are sustainable. You are safe at work. You get off work and go home, and, on your days off, you feel rested. You don't feel exhausted all the time and dreading going to work. So, by being healthy, I don't just mean physically, but I also mean mentally, psychologically healthy. Um, and all of that leads to better health outcomes for not only registered nurses, nurse practitioners, but for the people we care for in our healthcare system. So, if we're going to sustain our healthcare system and sustain our nursing workforce, that's what we need for the registered nurses, nurse practitioners who are working in the system at present.
Yvette, your final resolution was nurses realized. So when you think about the future of nursing in Newfoundland and Labrador, what does it mean for nurses to be fully realized in their role and in their career?
You talk about respect and recognition for the career that we've chosen as nurses, as registered nurses and nurse practitioners. True recognition is allowing registered nurses and nurse practitioners to work to their full scope of practice and to be compensated accordingly. So it's equal pay for equal work. It's not keep adding on and adding on and adding on to my scope of practice, to the work that I'm able to do, but keep me at the same rate of pay forever and a day. It's about mentorship and coaching and supporting support from leadership for new graduates, for registered nurses, nurse practitioners working in the system at present. It's about our future nurses. It's about nurses coming from different countries, from different provinces, and giving them the support that they need. It's about students having preceptors. Just this past week, I've been hearing the stories of, I have parents reach out to me of nursing students. I have students reach out to me, or they're reaching out to our staff here, and they're saying they can't even get a preceptorship. So they're paying for their clinical to go to do their clinical placement. So it's actually a course through Memorial University. They're paying for the course. They're going in, and basically, people have heard me talk about free labor. And I still say it's because we are a female-dominated profession, because other professions such as engineering are all paid placements, work terms. Instead, for nursing, now you're paying for it. You're paying to go in to do the free labor. And now we have nursing students being told, by the way, we don't have anyone to preceptor you. So we don't have anyone to take you on in the workplace. You go on in, and if there's no one to preceptor you today, you go home and you come back tomorrow, and we'll see if we can find you something. This is what people are paying for. That's the lack of respect for nursing. And it's not just the employer, that's society as a whole. So even though we know people support nurses, we do polling about, if we were to take strike action tomorrow or to do a rally, we know that people would support us, because people know that what we're telling them is true. I just point to the agency nursing and the report that came out by the Auditor General, which actually validated the concerns that were being brought forward, not only by the Registered Nurses Union, but by our members, because that's who brought these concerns to us and the public bringing. But to truly recognize and respect nursing as a profession, employers, governments, and the public all need to recognize that with that comes the appropriate compensation. With that comes respect in the workplace around decision-making, autonomy, especially for when I think about our nurse practitioners, being able to manage their own clients, be able to manage their own calendars. That to me is respect. And that to me makes clearer pathways and career choices for nurses in the system. And it actually creates leaders in the system, and it retains nurses. It will help to retain and sustain our nursing workforce.
What can members expect to see from RNU this year as we work toward these goals?
So our priority for 2026, you've heard us talk about collective bargaining. We've done a podcast, myself and David, about what collective bargaining is and what it means. We will continue this year. That is our number one priority. And coming from that is our advocacy, holding the employers, holding new government accountable for our healthcare system and what's happening in our healthcare system. And it's also about we commit to clear communication with our members, with you, and with the public, educating the public and educating our members about the real issues that we are facing on a daily basis in the workplaces here in this province. The issues that impact retention. We don't have a recruitment issue in Newfoundland and Labrador. We have a retention issue. And it is no good to recruit nurses into this system if we don't retain the ones who are currently there, holding it together. So that is our commitment to you and to the people of Newfoundland and Labrador, that we'll continue to advocate, that we will go into collective bargaining and seek to get the best collective agreement that we can get for our members. But we need your help to do that. So our call to action here is that every single registered nurse and nurse practitioner get involved or continue to be involved in identifying your priorities for collective bargaining, but also for advocating the concerns and issues in the workplace so that we can address them with the employers and with government.
And finally, what do you want to hear from nurses this year as we work through these resolutions together?
So along with your ideas and priorities for collective bargaining, we're asking for your participation. We're asking for you to volunteer. We're asking for you to document your issues or concerns in the workplace. And we're asking for you to stay engaged and continue to support each other in the workplace. If you're feeling exhausted, you need to speak up for yourself. If you need us, reach out to us. We have trained staff here at RNU who can help you with labor relations issue. We have a board of directors with regional representation whom you can go to with issues or concerns that you want escalated to the leadership of our union. And please, most importantly, take care of yourselves. Take care of your own mental and physical health, and take care of each other.
Thank you so much for that. That's it for this episode of Scrubbed In and Speaking Out. Thanks for listening, and don't forget to follow or subscribe for more conversations about nursing, advocacy, and the future of public health care in Newfoundland and Labrador.